Well, joining us now from Baltimore to discuss is emergency physician at the Johns Hopkins University, Dr. Gabe Kellen. Dr. Kellen, it's great to have you back on the show. Thanks for being here. I'm wondering what your reaction was when you heard that the death toll could actually be more than 300,000 more than we thought. That's at least according to this University of Washington analysis that came out last week.
Yeah, this is very challenging to get at an exact number, but a 50% or so increase is probably well within the ballpark. Could be a bit higher, could be a bit lower. And remember the way this methodology was done. They looked at the number of deaths naturally experienced in any given year, and then looked at this past year, the time that COVID has really taken hold, and found that, we have 300,000 or so more deaths than otherwise predicted. So it must be due to COVID. Now, let's also recall that it's not all 100% you got infected with COVID and died. These include people who have overdosed and died, which has increased, became very despondent and committed suicide. And particularly early on, there were many, many patients not counted who delayed care and were found dead at home by EMS, were never tested, and were almost certainly either delayed care for heart attacks, strokes and whatnot, or stayed at home very, very sick, being afraid to come to the hospital. The number may actually be a tad higher because in the model, the investigators discounted properly lower deaths in certain things like trauma, car accidents, and so forth. So related to COVID may actually be a little bit higher, but that's probably a pretty rational number. And we know globally it's probably even way more underestimated given the way many countries are unable to accurately count.
Yeah, Dr. Kellen, we wanted to ask you about that. I mean, what does this potentially say about tracking in other countries around the world?
Well, it doesn't say anything about tracking. We know that many countries do not have the type of resources as Western countries, and particularly the US, which has enormous resources to track almost each and every infection that comes to light, and then has a vast army of academics and scientists who can model out components like this as to what we're not counting. That doesn't exist in many, many countries around the world.
I want to talk a little bit about people who have been infected even after getting the vaccine. It is a tiny, tiny, tiny number of people. At the end of April, more than 9,000 Americans were reported to be infected after being vaccinated, a tiny percentage of the 95 million people who were fully inoculated at the time. I got to tell you, anecdotally speaking, I had someone on Friday who hasn't gotten the vaccine yet and is hesitant say to me, I've heard you can still get COVID even after getting the vaccine. And I'm wondering about messaging here.
Yeah, messaging is very difficult because people who are hesitant, facts don't tend to work. So when you say 9,000 people or so have had a new infection that's come to light out of 95 million, that is so tiny, but the 9,000 is what sticks in people's minds, not the 0.0001%, which is also a number that doesn't seem to, resonate with people. The issue is that it's tiny, and it's not like you can't get sick enough to go to the hospital, but that number is even smaller. And so, yes, some people will get infected. No vaccine is 100%. But that 9,000 versus 95 million or so is tinier than almost any other vaccine that is for general public use for an infectious disease. It's amazingly useful, and it's amazingly protective if that's what we're really dealing with.
So, Dr. Kellen, then how should the U.S. continue to encourage people to get vaccinated? Of course, the president has a goal of 70% by July 4th, but there is still that hesitancy for certain different reasons from different people. What would you say needs to happen from the top?
Yeah, I think we need to shift gears, and perhaps we already have. First, the good news, right? People over age 65, so we're approaching 85% of the US population over 65 have had at least one shot, and more than 70% have been fully vaccinated. I mean, that's well within the range of herd immunity for that group. And for adults, it's like close to 60% at least one shot. I mean, that's a big success. But as you allude, we are now running into almost a surplus of vaccine versus those who want it. So we know what doesn't work, right? Simply spewing facts into people's faces, showing pictures of people gasping for air, and calling people stupid and shaming them. I mean, those types of things don't work. We have learned a couple of things that work. Instead of just spewing facts at people, whether you agree with them or not, showing true empathy to their concerns. You have to be able to connect. The messaging has to come from people other than me, people that they trust, trusted figures in their communities or churches, or in some cases, it's sports figures. Personal physicians can be very, very powerful here. They may not trust almost anyone other than that long relationship if people are fortunate enough to have it. And then we've discovered some interesting techniques. When you bring vaccine, instead of making people come to your clinic for a vaccination, you do a mobile clinic and come to, say, certain parts of town. You set up shop somewhere, and then people start to get vaccinated. Others see that people like them are getting vaccinated, and all of a sudden they want in. And so there are other types of things that people have. This is anecdotal, but we know a person who swore up and down they're never getting the vaccine. They don't believe in it. And then they wanted to go on a cruise, and the cruise insisted they get a vaccine.
Right.
So I guess I'm going to get one.
Well,
so there are inducements. One is to really empathize and try and connect. The second is make it easy, literally bring the vaccine to people. And if you need to, it's unfortunate, but sometimes inducement works.
Well, Dr. Kellen, Governor of New Jersey, Phil Murphy, said he's open to the idea of actually paying people to get vaccinated. What do you make of that?
Yeah, I don't know if I'm the right one to answer that. I'm somewhat uneasy about it, but we do have a public health emergency. So there's kind of pros and cons. Once you start paying people to do the right thing, then you're going to have to start paying forever every time you want a major campaign like this that is in behalf of the public health. On the other hand, we have a deadly disease still amongst us, and we want to stamp this out as fast as possible.
Emergency physician at Johns Hopkins University, Dr. Gabe Kellen, live from Baltimore. Dr. Kellen, thanks so much for taking the time and for joining us this morning. We should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies. Thanks for watching Bloomberg Quick Take Now. Subscribe to our channel to see the biggest stories the moment they happen from around the world. And tune in to our 24/7 live stream for global news coverage, interviews, deep dive shows, and documentaries on the stories you care about most.